The CEAP classification system for chronic superficial venous disease is a classification system that's utilized both academically and clinically to identify and classify patients' presentations as well as potential management pathways. CEAP is an acronym for a number of identifying factors associated with venous hypertension and chronic superficial venous disease. C stands for clinical. What's the clinical presentation of the patient? E stands for environmental. What type of environmental causes may potentially be associated with the patient's presentation? A stands for anatomy. Are there anatomical considerations that may potentially lead to the patient's portal hypertension and thus identify areas of treatment? And P is pathophysiological. Are there any pathological conditions that may potentially affect the presentation or the severity of the presentation? Practically speaking, the most important aspect from a primary care perspective is the identification of the C class, or otherwise known as the clinical representation or clinical manifestation. Within the CEAP classification system, the C class, which is practically the most important class from a clinical standpoint, is broken up into 6 categories, each representing a more severe presentation of disease. C class 1 is generally represented by reticular veins and small spider veins. C class 2 are the classic varicosities if presenting by themselves. C class 3 represents varicose veins along with associated soft tissue swelling. C class 4 represents soft tissue swelling and potential chronic skin changes or trophic skin changes. C class 5 is associated with a healed venous ulcer, and C class 6, which is the most severe, represents a chronic unhealed venous ulcer.